plan our weddings, we plan for our baby's arrival, we even plan for funerals, but are you planning for home care? You know what? We all might need it someday. Millions of Americans, adult Americans, are caregivers for their loved ones. But you don't want to be caught at the last minute needing help. You want to pre-plan for that help. And here with some great tips on how to do that is Jennifer FitzPatrick. She's an author, she's an educator, and many caregivers call her their lifeline. So thank you for joining us, Jennifer. Let's talk about assuming that a caregiver is not desperate for help. What is the first thing that we should do in going about pre-planning?
Well, first you can ask friends, family, people that you trust, your doctor, do they have a specific recommendation of an agency that you should work with? If that's not available, I recommend going to your local area agency on aging in Phoenix, and it's AAAPHX.org. Ask them for their list of registered, licensed home care agencies. We're talking about agencies, not individuals.
Okay, individuals, that's very different. And you have to do, there's a whole different set of rules for individuals, correct?
Absolutely. If you personally know someone, you've done a background check, you're 100% comfortable, but working with an individual that is not with an agency, licensed, vetted, that can often go terribly wrong.
Okay, so we make that initial phone call. We find we need some help. What are some of the top 3 most important questions we should be asking?
What kind of training do you give your teams? What kind of supervision does that aide who comes into your loved one's home or your home receive? Typically, a nurse is going to be that person that looks after and supervises that aide. And then also, do you have any hourly minimums?
Ooh, okay, I hadn't thought about that. There's also a big difference between, what our loved ones' needs might be. Would we be expecting to pay more for someone who has some medical training? Because perhaps we might need that, and perhaps we don't. And is there a big difference in what that would cost?
Absolutely. So home care is a non-skilled service, whereas home health is a service that's more of a nurse or a physical therapist, that sort of thing. And so, yeah, that would be more expensive. And sometimes Medicare will actually pay for home health, but it never really pays for home care.
Okay, so it sounds like what we really need to know, do we need home care or home health care? That's a big one. I didn't really even think about that. Here's another question a lot of us may have is that, how do we know if they're coming into our home? We can kind of keep an eye on the help and whatnot, but if they're going into our loved one's home, we're not there. Maybe they're in a different state. How can we be sure that our loved ones are safe?
Well, you can never be 100% sure, but the best way to do it is to work with an accredited, registered, licensed agency that supervises. They have all sorts of protocol in place to make sure that your loved one is safe. It's never going to be 100%. Some families will feel more comfortable with cameras in the home, but also just have a conversation with your loved one about if the person is asking for money or anything like that. It's rare, but once in a while, that sort of thing will happen. You want to report anything like that directly to the agency.
Yeah, those could be, that could be a major red flag right there. So working through an agency, it sounds like, has lots of benefits. They kind of do a lot of the legwork for us.
And they're a little bit more expensive, but I believe it reduces the headaches down the road rather than using an individual.
All right, excellent. Well, I can see why you're the lifeline to caregivers, because you're a wealth of knowledge. Thank you so much, Jennifer. And that one website, it's a government website. It's AAAPHX.org for a list of licensed agencies. I also have a list of other resources for you, including Jennifer. We put them on our website, sonoranliving.com.